Welcome back to A Healthy Dose. I'm Julie Stoutland, talking with Justine Schilstra, a registered midwife. While pregnancy, labor, and delivery is miraculous and entirely natural, it can be unpredictable. So let's talk about what happens when things don't go according to plan. Okay, let's talk about what's the biggest challenge you face as a midwife in providing safe care.
So it can be challenging when clients decline routine care and assessments. So,
Are you able to do that?
oh yes,
Yeah.
and that's one of the tenets that when I talk about informed choice, right? So nobody can force you to do things. We have things that we would like you to do. It helps me to have your blood work, and it helps me to have your ultrasound. And so when people choose not to do those things, it just limits my ability to really fully assess the situation and provide you the best care.
Yeah, I would definitely say that would be an issue. So if you have a yellow flag, it's hard to catch it before it becomes a red flag.
Exactly. Yeah. So being able to use my assessment tools, being able to listen to the baby, being able to use my hands, that allows me to catch yellow flags before they can become red flags.
So how do you navigate that informed choice versus professional responsibility? Because that can't be easy.
No. So that's where our time and appointments really comes in handy. So giving the opportunity to kind of provide the information, give you the written information to show why we want to recommend something
Yeah.
to you. And ultimately, though, the choice is yours. As the client, you're in charge of your care, and believing that people have their baby's best interest in hand. And even if it's not what I would do, empathizing with people and trying to understand where they're coming from in making those decisions.
So how would you determine when interventions are absolutely necessary?
Yeah. So that's one of our jobs, is to trust the body and normal birth, but also knowing that unfortunately birth can go wrong sometimes. And so when we intervene, we want to do it in a timely and appropriate way to catch things before they really snowball.
So social media sometimes promotes the idea of a pain-free birth. Let's be honest, is this really realistic? Because I know mine wasn't pain-free.
No, mine wasn't either. What I would say is I think you can have a calm birth despite the pain. I think that's what people are portraying, that you don't have to be screaming and writhing. Like you can remain calm through it. But if you do have to scream and writhe, it doesn't mean you failed or did something wrong either. But the social media presentation of a calm, quiet birth, I have seen it happen, and more than once. So it's not a complete anomaly. It can be done. And I think it's more about the mindset.
I think that's
people.
a good point to make. Then, no matter what, when we go into something in life, if we go in anxious and we go in already uptight, it never really goes well.
No, exactly. Yeah, like the stress hormones, that's a real thing, right? When our cortisol is high, our body is more tense. When our shoulders are tense, when our jaw is tense, our hips are too.
Right.
And we have to allow that baby to come down and through.
Absolutely. So what are some of these factors of that you may run into, the position of the baby or the sleep people like mother had, or
So there are things that will make a labor go nice and smooth, and you can totally accomplish that calm birth. So if you've had a good night's rest and you happen to start your labor after some sleep, we like a baby to be forward facing. So the back would be towards the mom's belly button. That's the nicest way for them to tuck in. I have experienced myself the baby who's back to back, and I've watched women do that too. Yeah. And so it's definitely a much more painful experience.
Yes.
So we call that malposition. So a baby that's malpositioned, a mom that is completely exhausted, and the longer the labor too, those can impact our labor experience.
Yes, I definitely had that with my first one, and I can attest that it was way more painful than my second one. We're like, oh, so this is how it's supposed to be.
Right, it can be like this. Yes.
It's not supposed to be that bad. Okay. So let's say for someone considering midwifery, what should they think about? Are there any questions that you can give me one, and then we're going to go to the break. But is there any questions that they help them to narrow it down?
Yeah, so I think you want to think about who am I going to be the most at ease with? I want to be in the hands of a care provider that I really trust. And so ask yourself, are these things informed choice, continuity of care? Are those things important to me or not?
All right, let's see if there's more after the break. So in our final segment, we'll talk about how to decide if midwifery is right for you and how to approach that decision with confidence.